Dr. James and Dr. Newman here to talk about National Healthcare Decisions Day. All right, ladies, you have to explain, what is this day?
So National Healthcare Decisions Day is a day to really empower, educate, and give people the opportunity to start talking to their family and friends and their loved ones about their healthcare decisions.
Okay, this is a hard topic, I guess, to bring up, and so maybe having a day is a little bit easier?
I think in some ways the day gives people permission to have that discussion. Some families look at things with some humor, so you think of death and taxes, two things that are for sure in life. So maybe throw in a little humor in there with your family and start having that discussion.
Now, what kinds of things should you be talking about whenever you discuss, these things?
The important thing is what you want and what you don't want in your healthcare. If you are unable to speak for yourself, let somebody else that you trust be your voice to share with your healthcare team what you want and what you don't want.
A lot of people talk about, end-of-life care. Is that a topic that you would suggest, really needs to come up on this day?
Absolutely. I'm actually a medical director for Unity Hospice here in town, so I do a lot of care of patients at end of life. And me and my team members who care for these people in their homes find it very difficult if the patient has not expressed any wishes at all. It's exceptionally hard on the family members who are already experiencing a devastating loss to try and figure out what would be the right thing to do for their loved one or what their loved one would have most wanted.
Does this help to bring it out in the open like this rather than it being, you know what I mean?
Yep.
For everybody?
Yep.
And rather it being a thing on the back burner.
Exactly.
And then, when everything's
there's nothing wrong with it. It's part of life.
There's not only nothing wrong with it, but anyone who's 18 years or older should actually have a document drawn up that already states what their wishes are should they not be able to make decisions for themselves. That document can be changed at any time throughout life and as many times as you want. So it doesn't mean that once you make the document, you're done. It can be changed at any time.
So this is something any adult should be doing.
Some family members, I think, would put "do not resuscitate." What's it called? Resuscitate. Resuscitate for me, no matter what happens. Okay. And this is a true story. I've got it written down that I'm gonna have closed casket. Do you know why? I know they wouldn't get my hair right, and I'm so particular about that. It's going to be closed. I've got it written down.
It's the humor, but it's
exactly
true.
Right. We want you to talk about things before you get to the casket part.
Yes.
But all that is important. So
Absolutely.
people aren't trying to guess. And it's really, some people think it's pessimistic, like, oh my gosh. But it's really about empowerment.
Right.
It's really about being in control.
Absolutely. I don't want the receding part showing.
There you go.
Fair enough.
It's also, in this day and age, there's a lot of talk now about medical futility, and that's a really important topic. You don't want to have to go through suffering that your doctor tells your family likely isn't going to have the outcome that you're thinking it would have. But once again, if you don't have these discussions with your loved ones, you leave them hanging in the balance.
And it leaves more stress for them. That's the last thing that they need at those times. All
Right.
right, ladies, thank you so much for being with us. Good insight there.
If I don't look good, I don't want to be seen.
There you go. Mino's got it all figured out. And there are, of course, numerous community events coming up for the public to learn more about Healthcare Decisions Day. Those are all taking place in Northeast Wisconsin. Now, to see those locations, times, and dates, just visit NBC26.com and click on this story.
All right.
Thank you, ladies.
Thank you.